Hey everyone, Dr. Kevin here today over at HealthFit, and today I want to go a little bit over split squats, which is oftentimes a very common lower body exercise that is really helpful for just strengthening, but also in terms of rehab. A lot of times when people have like hip discomfort or knee pain, one of the things that we tend to have people do is split squats because it allows you to bias one leg over the other. So sometimes people might have difficulty with practicing squats like that. People talk about having knee pain, and so one of the ways to try to isolate one side is to switch into a split squat position, which ends up looking like this. You have one leg in front, one leg in back behind you. On the side, this is where it gets interesting when it comes to variations, because if you are bringing more of the knees over your toes position, you end up getting more quad involvement or thigh involvement. Or if you kind of stay more into like a 90-degree straight drop down, you end up getting a little bit more hip engagement as well too. Sometimes when people tend to have knee pain, one of the ways for us to try to get them to learn how to use their hips, their glutes a little bit more, is to set them up in a split squat position. When we are in a split squat position, we want to be able to get this type of movement. If we're trying to get more hip engagement, then we want to think about dropping straight down as opposed to having your knee drive forward, which allows you to use more of your thighs. Now, the reason why this would not be what we want to do when someone's got knee pain is this may aggravate their discomfort there a little bit more. So if we shift it back a little bit and we allow them to drop straight down, that's going to allow us to work on recruitment for the hips, which that may be an influence as to why someone is having some knee pain or not. And the other thing too is this allows us to kind of focus both on one leg at a time. So if we need to take one leg a little bit more out of the picture, we get to do that with our split squats. So if you're having some sort of pain, whether it's at your knee or your lower back or your hip, it may be helpful to have someone take a look at it to see whether or not this can be a benefit for you. So if you have any questions, feel free to contact us and we'd be happy to help you. Have a good day.